Go.
Hi, this lab is C11. It's used for medical surgical labs, workshops, and also primarily for pharmacology, which you can see the whole room. We have our seating marked off so that students are an appropriate distance apart when they're in the lab, and can still be able to be here on campus doing activities so they can learn the important pharmacology techniques. The class right now is finishing up learning about how to start IVs and how to run fluids and medications into a patient by using an IV, an intravenous. So a needle goes into your vein, and then fluid can be administered, medication can be administered in that. And what we have here, this is really simulated blood, so that when you start the IV, then you would get a blood coming back in that needle, a flashback it's called, and that's how you know that you're in the appropriate place to be able to give them the fluid or the medication. So we also have here an IV pump. These are the current models that they have at least one of our hospitals in town. We like to try to keep as many things current as we can for the students. This is a way that medication and fluid can be administered, and the pump actually counts the amount so that we're not overloading the patient, nor are we not including enough. When I started in school and working, we had to actually manually count all the time. They didn't have very many pumps, and so we wanted to make sure we got the right amount in. It's much easier to have the pumps running. We still have to be responsible for setting them correctly and making sure they're running appropriately, but it is a great help with our nursing time. We have here a mannequin also who we can have an EKG tracing, a heart rate tracing showing up on the monitor. We have a ventilator so that the students can learn how to control those and set those for if they were working in an intensive care unit. We also have oxygen, so the students can learn how to attach oxygen and administer oxygen to a patient. Along the top of the bed, you see some equipment. These are called head walls. They include oxygen, medical air, suction, and emergency power. Now, in our building here, the red outlets are not really emergency power, but at a hospital, those outlets would be active even if the power was out. That way, for example, if this student or if this patient did have a ventilator, you would want to have it plugged in even when the power was out. So that's how we would use that. And this way, our students can all practice how to attach this equipment when they're working in the hospital. Again, we have more mannequins here so that students can practice talking with the mannequins. We have some pretend food because food can always interact with medications, and we want you to learn appropriate things a patient can and cannot or should not eat or drink whenever they're taking certain medications. We have everybody, I think they're all asleep right now. We have the masks on. They wouldn't really be wearing those masks as patients, but we've kind of tried to keep everybody aware of safe cautions during COVID. You're looking right now at a crash cart or a code cart. We have a machine on the top where it can be hooked up to a patient, and you could see their EKG tracing, their heart tracing. And then in each of the drawers, there's equipment for if you needed to do a code. If there was some reason their heart had stopped or they were having trouble and it's locked apparently, which is a good thing. You really shouldn't have a code cart open. There should be a way to unlock it. So we're prepared so that students can learn how to do this kind of care. Okay. These are the pads you've maybe seen on TV where they're going to shock someone, their heart is stopped, and so they can put both of the pads on, and remember they'll tell everybody to clear away because they don't want you to get shocked when you're there touching the patient, and then you would administer a shock that could hopefully restart the patient's heart. We can simulate lots of different kinds of heart rhythms with this equipment. We have cabinets here that have simulated medications, so that one of your assignments in the course, and by the way, the pharmacology course would be in your first semester in the nursing program. It's very important that you would learn these things before you go to a hospital clinical. So here we have simulated IV fluids. Remember, they've just been learning how to start IVs, and one of the next few few weeks, they will learn how to administer simulated medications to the patients.